Hey guys, Alyssa here. Welcome to the Geros Health podcast, where we make it easier for you to better serve older adults. I'm your host, Alyssa, and this is the Old Not Weak segment. In today's episode, we're going to be talking about post-operative hip fractures, interventions, and if we can improve the effectiveness of these interventions. So this was kind of sprout upon because it seems lately I have seen quite a few patients that have been status post hip fracture, whether it's chronic or acute. And it got me kind of thinking about the types of interventions we use. Can we do things better? Are we doing things great and we can keep them that way? That sort of thing. So I got to reading a study that was titled The Effectiveness of Home-Based Intervention Programs in Reducing Mortality of Hip Fracture Patients, and it was a non-randomized control trial. So the main objective of this study was to look at whether a post-operative intervention with the addition of nutrition plus physical exercise is effective in reducing mortality and improving mobility in older patients with hip fractures compared to a control group applying the usual care, and then they followed up. So we know that in our older adult population, hip fractures are unfortunately pretty common, and that could be due to low bone mineral density, due to poor nutrition or inadequate minerals, not enough physical activity. But it can also be related or associated with major morbidity, loss of independence, and then even an increased mortality rate, which compared to older people living in the community without a hip fracture, older adults with a hip fracture have an increase in mortality from 8.4% to 36% for the first year after the fracture, which is obviously pretty high, but it also is a pretty large range. And what I found interesting, and, when you come to think about it, we don't always get every patient that is status post hip fracture. So more than half of older people with hip fracture, or hip fracture survivors, they call them, do not regain their pre-injury functional abilities even 2 years after injury. So that's saying less than half of the people are able to do the things that they were doing beforehand. And we see that, constantly, or I see that in home health. People aren't able to do the things that they need to right away, and then we obviously try to get them to that point. And most of the time we're successful at getting them to that point, but then if you think about the amount of hip fractures that happen and the amount of patients that we see that are status post hip fracture and the amount of people that maybe will fall through the cracks. So this study is kind of looking at how can we extend our reach of facilitating improving outcomes in maybe say busier hospitals or lower income hospitals, or how can we create a larger reach. So, and we know that ultimately adequate mobility is the key component for active and healthy aging, and definitely helps facilitate improved outcomes. So, and the reason they added that nutrition piece in is because the prevalence of malnutrition, may reach up to 63% in older people, which is quoted in this study. And, we see it firsthand. People who are, I have a lot of patients who are on Ensure, who drink that regularly, but sometimes patients don't understand the importance of, getting certain minerals, and they don't know the composition of proteins, fats, and carbohydrates because they're just not educated on it. So a lot of people are malnutritioned and they don't even know it. So they wanted to look at nutrition in addition to physical activity, because poor nutritional status in patients with hip fractures is associated with impaired muscle function and obviously disability. So also you have lower mental function, then you have your loss of independence, and then decreased quality of life. So it kind of snowballs into these much larger problems just stemming from simple malnutrition. So they used nurses. So there were no physical therapists involved in this study at all. They used 2 nurses. They had 124 patients over a couple of years. And they had, I believe, 60 some. It was a little over 50 in the control and a little over 50 in the intervention. So it was a decent mix there, but not a ton of patients. So they basically took these 2 nurses that were involved in the study and they trained them on the nutrition and the physical activity. They weren't actually administering the physical activity. What they did is they put all this information in a leaflet or a handout and gave it to the patient. But they did provide education on the physical activity and on the nutrition. It was all pretty simple information, but it was better than patients getting nothing if they didn't have physical therapists in the hospital because it was, a lower income or they had short-staffed or things of that nature. So they started the education session it was during the post-operative hospital stay, and it was about 20 minutes. And then they did a very short second session right before discharge to kind of follow up to see if they understood all the information. And I wanted to go on a tangent for a second for this. So these handouts that they were given are from the Oxford University hospitals. And I went to the link and I started looking around. So there are patient information leaflets from NHS or the Oxford University hospitals. And they have so much information condensed into these couple of page handouts regarding, all sorts of things, whether it's just simply medical information. It talks a lot about tons of different things. And just talking about heart failure and, help with alcohol, like I'm just reading a few of them, help with alcohol, help your clavicle recover from a fracture, hernia repairs, just kind of giving some information either on a certain medical diagnosis or on some sort of rehab or some sort of intervention to help. So I will post the link in the show notes for the hip one, the hip exercises they gave. But you can also I'll see if I can just post the main website because they have a lot of information. They have, knee exercises, just very simple and condensed things that would be nice to be able to hand out to patients. So they gave those exercises. Now, what they did is once they were discharged, they followed up with 3 months, 6 months, and 12 months, so a year out. And what they did is when they called, they used the WOMAC, so the Western Ontario and McMaster University's Osteoarthritis Index, which has been validated for telephone assessment. And it's available in all sorts of languages to assess pain, stiffness, and physical function in patients with hip or knee osteoarthritis. So they went through this, and you can look up the outcome measure for the actual specific things that they go through. Now, you have to keep in mind that this is all subjective and it's over the phone. So there obviously is going to be some sort of maybe a little bit of discrepancy there. But generally, it was about a 10 to 15 minute phone call. And surprisingly, they had most of their people follow up. So I believe so each side had a few deaths. So it wasn't the full, it was 71 in the control group and 76 in the intervention group. So, and then they both kind of, after they went through everything, they both had, we had 60 in the control and 64 in the intervention. At the 12-month follow-up, we had 30 in the control and 48 in the intervention. So there was actually a better turnout in the intervention. And what they found was, if they were a part of the intervention group, they had less post-operative problems. So they were much higher prevalence in the control group. Now, the control group just got the usual care, which was they encouraged mobility up to, after 24 hours of surgery, but they never really followed up on it, nor never really gave a whole lot of information on what to exactly do. They just kind of said to move around. So, heart attacks and chest infections were the two main ones that were most common in the control group. And this could be because of lack of physical activity, you're more sedentary once you're going through this, you have pain, those kinds of things, less motivation. So it could be a whole lot of different things. They also looked a lot at daily sun exposure for vitamin D, which I thought was kind of interesting because you never really think about, and a big part of the nutrition thing was that they encourage people to get outside and to go get as much vitamin D, as they could. So obviously the people in the intervention group did get more sun exposure just because they were educated on it, but also because they were doing exercise, they were able to get outside easier. So those kind of went hand in hand with the outcomes. You can move easier, then you're more apt to go outside and you're more motivated to go interact with the outside world. Then they also looked at 1 year mortality. So it was 43% in the control group and then 26% in the intervention group, which is a very significant difference. So those are just a few details. So obviously our main goal for rehab is to get them back to their current status. So that's one thing they didn't exactly measure, but they used the WOMAC to kind of see and they didn't mention a whole lot about prior level of function and if they were able to achieve that, but they just looked at WOMAC scores and looked at the changes. So, and they obviously found that the physical exercise program was more effective than the nutrition part, and that was due to the WOMAC index, which was reported to be better in the intervention group in the 3 post-op evaluations compared to the control group, because they did the WOMAC on the control group as well, and it was better in the intervention group. The one thing they didn't mention about the intervention group is how many times they told them to do it, and I don't think it mentions it on the handout, so that would be one thing. But as a whole, the intervention group had better WOMAC scores, so better function, better outcomes, decreased mortality, and they had less post-operative complications. So those kind of were the big 3 that they looked at to say, okay, this can be an effective post-op program to help improve outcomes. And then I got to kind of thinking about this study and how it could be kind of applied and how we could use this information as physical therapists to kind of carry over into our treatment. So one thing I took from this was maybe we're not addressing everything we could be in order to improve outcomes. So the nutrition piece is a big one that I think gets missed a lot, whether we're not, necessarily comfortable giving nutrition advice due to lack of knowledge or lack of confidence in our knowledge on it. And one thing I took away from this was it just needs to be simple things. They go into a lot more detail on the nutrition piece. If you're interested, you can check out this study about dairy consumption, and are they, intaking enough minerals and all those types of things. And they looked at specifically eggs and that kind of stuff. So, and the vitamin D sun exposure was a big one. So, that could be one thing that we could be encouraging our patients as, we go to their houses, or we can encourage them. I do always try to do this just because of a study I looked at way before on depression and getting outside. So I always do kind of incorporate that. But it could also be another education piece that, you want to try, especially as it hits the summer months, or if you're in a warmer city or state. Now, so that's one thing, that maybe we can take this nutrition piece of it, and if we can kind of mention just even a few things to educate our patients, then maybe we can either help expedite our healing process and our rehab process, or they can kind of share the information with their friends who are doing it, that kind of thing. So we could help improve our outcomes that way. The second thing was just finding a simple exercise program that is kind of laid out for our patients. And I know that we have, a lot of times we just try to experiment and see what works for them and what doesn't, and that type of thing. But this website that they gives a very good layout of a home exercise program. So if you ever find yourself, kind of in a pinch to put together a home exercise program, I know I find myself writing things out a lot and not necessarily drawing pictures, because I'm just handwriting everything. So this would be maybe one other way to help increase adherence if they can actually see a picture of it. And this website does a pretty good job at showing the pictures. And also, this is kind of applicable to someone working in a hospital, that you could almost kind of adapt this home intervention, especially for patients who may not seem like someone who would necessarily follow up with home health, or may not seem like someone who's going to follow up with any sort of rehab, or maybe someone who doesn't have the resources to follow up with rehab, or someone who thinks that, they don't need rehab. That if we can just even give them this sort of information, kind of get everything planted out, this is what I want you to carry out when you go home, and that type of thing. So especially in the acute care, we can actually kind of implement this exactly how it is, besides the follow-up calls. And that's, one thing that you could help encourage rehab and things like that afterwards, that you have to kind of stay with it for a few months and, almost up to a year before you might be able to get back to your prior level of function, that type of thing, to help kind of encourage more of a long-term adherence, which is why they followed up. I think they followed up at 3, 6, and 12 months to see how much that WOMAC score could improve on. So it's we got to kind of imprint in their minds one of those things, that this is not just, you have to do these exercises for, 4 weeks. It's going to be a long-term process if you want to get back to the things you were doing before. So those were kind of my takeaways on this, and I know that especially for me, my biggest one was the nutrition piece. And like I said, there's much more details in this study if you're interested on specifics regarding what type of education you can give. They didn't provide the leaflet that they used, but that could just be one thing that we also try to think about and try to encourage. And also it just kind of pushes the importance of our profession as a whole, and the idea of structured exercise. Patients know what they need to do, and then they'll do it. If you just say you need to go home and exercise, then they don't really know what to do. So this is kind of, again, giving them some sort of direction, which is what home health and the sniff stay and things like that. That's obviously the purpose of us seeing them. But like I said, if it's someone who doesn't have those resources or who may not follow up, they might benefit from something more along these lines, that it's just kind of easier to address it kind of right out of the gate at the hospital. So like I said, I'll post some things in the show notes, and hopefully you guys learned something today. Thank you for listening to the Geros Health Podcast. If you go to geroshealth.com, you can get the show notes for this episode, and you can learn how to join our Geros community. You'll get access to our private group and weekly recaps of our favorite reads, podcasts, and any interesting conversations from the Geros community. Once again, that's www.geroshealth.com. Thanks for listening, guys.